and good morning. Welcome to Mental Health Talk with NSD Mental Health Services. And this is, my name is Dr. Lola. Thanks for joining again. And today we're going to be talking about ADHD. So, what is ADHD? Attention Deficit Hyperactivity Disorder is a neuropsychiatric condition. It affects preschoolers, children, adolescents, and adults around the world. Is characterized by a pattern of diminished sustained attention and increased impulsivity or hyperactivity. What are some of the causes? The causes are based on family history, genotyping, neuroimaging studies, and there is clear evidence to support a biological basis for ADHD. Although multiple regions of the brain and several neurotransmitters have been implicated in the emergence of symptoms, dopamine continues to be a focus of investigation regarding ADHD symptoms. The prefrontal cortex of the brain has been implicated because of its high utilization of dopamine and its reciprocal connections with other brain regions involved in the attention, inhibition, decision making, response inhibition, and working memory and vigilance. Who is affected by ADHD? ADHD affects up to 5 to 8% of school-age children, with 60 to 85% of those diagnosed as children continuing to meet criteria for the disorder, even in adolescents. Up to 60% continue to be symptomatic into adulthood. Children, adolescents, adults with ADHD often have significant impairment in academic functioning as well as social and interpersonal situations. This is why it's important to, when an adult comes in for clinical assessment, it's very important to ask about um, how was the grades in preschool, high school, elementary, even college, and was there any tutoring or remedial classes involved. It's important to assess for any behavioral issues in school as well. We'll go into further details in coming series. So comorbid disorders associated with ADHD also include learning disorders, anxiety disorders, mood disorders, and disruptive behavioral disorders. There has been some changes to the ADHD DSM-5 diagnostic criteria. One, in the past, ADHD symptoms had to be present by age 7. However, in the new DSM criteria, several inattentive or hyperactive impulsive symptoms must be present by age 12. So they changed it from age 7 to age 12. The three new specifiers are combined presentation, predominantly inattentive presentation, or predominantly hyperactive impulsive presentation. So again, one of the three. The changes in the DSM-5 also permit a comorbid ADHD and autism spectrum diagnosis to be made at the same time. So finally, in DSM-5 for adolescents and 17 years and older and for adults, only 5 symptoms rather than the 6 symptoms of either the inattentive or hyperactivity and impulsivity are required. So what are some DSM-5 criteria for ADHD? For inattentive type, 6 or more symptoms of inattention for children up to age 16 years of age, or 5 or more symptoms for adolescents aged 17 years and older and adults must be present. So some of the symptoms are often fail to give close attention to details or make careless mistakes in schoolwork, at work, or with other activities. Often has trouble holding attention on tasks or play activities. Often does not seem to listen when spoken to directly. Often does not follow through on instructions and fails to finish schoolwork, chores, or duties in the workplace. For instance, loses focus, is sidetracked, often has trouble organizing tasks and activities, often avoids, dislikes, or is reluctant to do tasks that require mental effort over a long period of time, such as schoolwork or even homework, often loses things necessary for tasks and activity like school material, pencil, books, tools, wallet, key, paperwork, eyeglasses, mobile telephones, often distracted, easily distracted, or forgetful in daily activities. Though these symptoms, it's important to have some of these symptoms by age 12 in adults. Sometimes adults are not diagnosed based on parents' perception or stigma and things like that. So oftentimes some people are not even diagnosed till adult or till when they get to the adult stage. So it's very important to be mindful of this as well. The symptoms of hyperactivity and impulsivity, impulsivity that needs to be observed are often fidget with or taps ends of feet or squirms in feet, often leaves seats in situations when remaining seated is expected, often runs about or climbs in situations where it is not appropriate, often unable to play or take part in leisure activities quietly, is often on the go, acting as if driven by a model, often talks excessively, often blots out an answer before a question has been completed, often has trouble waiting their turn, often interrupts or intrudes on others. So again, these are the hyperactivity and impulsivity. 6 or more symptoms needs to be present for children, and up to age 16 years, 6 or more symptoms need to be present. 5 or more needs to be present for adolescent age 17 years and older. In addition, the following conditions must also be met. So not just those 5 symptoms, but the inattentive or hyperactivity impulsive symptoms must be present before age 12. Again, initially it was age 7, but now it must be present before age 12. The symptoms must be present in 2 or more settings, meaning not just solely at home, school, or work, but there has to be symptoms must be present either at home and school, or school and work, or things like that, with friends or relatives. So it must be present in 2 or more settings. There must be clear evidence that the symptoms interfere with or reduce the quality of social, school, or work conditioning. The symptoms are not better explained by another mental disorder, such as mood disorder, either bipolar disorder or anxiety disorder, dissociative disorder, personality disorder. The symptoms do not happen only during the course of schizophrenia or another psychotic disorder. So one needs to be mindful of this, and also in the book also it mentions substance use as well, or substance abuse. So you want to be mindful of that when coming for clinical presentation, when the patient is already under the influence of either um, substances, meth, ecstasy, whatever the case may be, the diagnosis cannot be made because of the fact that the substance use is present. All right. Based on the types of symptoms, 3 kinds of ADHD can occur, like we talked about. The combined presentation, if enough symptoms of both criteria, inattention and hyperactivity, impulsivity, were present for the past 6 months. The 6 months is also a criteria. Predominantly inattentive presentation is present if enough symptoms of inattention but not hyperactivity type were present for the past 6 months. Note the 6 month. Or predominantly hyperactivity impulsive presentation were present for the past 6 months. So again, it needs to be present consistently for 6 months. It needs to have, some symptoms must have occurred prior to age 12, as mentioned above, and also 2 settings needs to be present, 2 or more settings. Um, There has to be clear evidence that it interferes with quality of school, work, or social setting. Because sometimes patients might come in and they might be, oh, okay, they feel they might have ADHD. If they are not currently working and they're not currently in school, it becomes very difficult to make that diagnosis, because again, it's not impairing, you know, I mean, the two settings are not included in that instance. Also, sometimes they might say, oh, okay, in the past they've not been able to sustain jobs due to the HDHD symptoms. Again, that becomes a little difficult because of the fact that um, we don't have observer information and we don't have school information as well. So we're just going by self-report. There will be upcoming series in coming days or weeks on the etiology and management of ADHD. Thanks for listening. Again, please subscribe to our channel. Continue to follow our Facebook page, NSD Mental Health Services LLC. Continue to follow us on Instagram. We appreciate. Thank you and have a blessed day.